So, what are the learning outcomes? Understanding the importance of dental health, knowledge of dental prevention, sharing some tips, and promotion of digital health in the community. Significance of a confident smile. The lady is smiling, she's happy. What does confident smile mean to you? What is your definition of a confident smile? Confident smile is what is in this picture. The lady smiling and being very happy. This tells you how important your teeth is. So what led to this webinar? So what is the why? So one day I went to work and I noticed a lot of children were being put to sleep to have their teeth removed. According to 𝗣𝗿𝗄𝗏.gov.uk, about 47,000 children between the ages of 0 to 19 had their teeth removed due to teeth decay, and this cost the health service about £40 million. This is what motivated me to do this presentation, to educate, sharing knowledge. I believe in the CAP model of knowledge, attitude, and behavior. And this is a statistic, and this from The Guardian. And it says number of children having rotten teeth extracted in hospitals and due to tooth decay costs the health service £40.7 million. And this is a statistic which was published on the 8th of February 2024. The picture you see is an arrested decay. So when you eat a lot of sweet, your teeth become soft and brown. But when the tooth repairs itself, it shows as black. One may ask, what causes tooth decay? Tooth decay occurs when bacteria in your mouth feeds on the sugar in the food to produce acid. This acid attacks the teeth, and that's what leads to teeth decay. In this webinar, we will cover ground rules, about me, what I have done, dental prevention and tips, and questions and answers. Now, for the purposes of this presentation, if you have any questions, please put it in the comments. About me, I'm an innovative dental surgeon. I'm a mentor. I'm a poet. I'm a teacher. I'm the author of 3 books. My philosophy of life is to make a difference which becomes a ripple effect to inspire the next generation. Here's what I've done in the past. The first book I wrote was Positive Work-Life Balance. The second book I wrote was Mommy, What is Tooth Decay? Prevention is better than cure. And this has recently become a #1 bestseller. So you could go to Amazon and get a copy. And the last book I wrote was Book of Poetry, Why I Create. I love poetry. This is some of the things I've done in the past. Being a King's alumni, I went to Guys to plant some flowers as part of King's Global Day of Service. I have volunteered at TEDx London. I love voluntary work. And I was also part of this TEDx NHS. And this is the launch party. This is what I've done in the past. I took part in artificial intelligence versus corona hackathon during the lockdown with data scientists, and our team won the first prize. I'm not what I have done, I'm what I have overcome. Other things I've done is being part of this team, the research we did over online, which was great. I also took part in Clinician Burnout Conference. Now we're going to talk about the teeth. There are 2 sets of teeth in your lifetime, your baby teeth and your adult teeth. Your baby teeth, after your teeth have fallen out, you are left with only your adult teeth for the rest of your life. If you take good care of your adult teeth, it will take very good care of you. Teeth is very important for speech, eating, and feeling very confident about yourselves. So take good care of it. Nursing caries. So what is nursing caries? So this happens if, for example, a mom is breastfeeding the baby and the baby falls asleep. As soon as the baby falls asleep, please take the breast out of the mouth. If you leave the breast in the mouth, because the child is asleep and there's no washing of the bacteria with the saliva and the milk, it eats the teeth and leads to decay. That's what is nursing caries. So nursing caries is dental decay as a result of leaving the breast in the mouth. What is gum disease? Gum disease, a healthy mouth should not bleed. Therefore, if you see blood in your mouth, that's the first stages of gum disease. Gingivitis is the inflammation of the gums. Periodontitis is when there's a breakdown in the bone. I always tell my patients the gums are like the foundation of a building, and you need to take very good care of them. Losing your teeth is like bereavements. So the first stages of gum disease is gingivitis. If you ignore it, periodontitis. And there are some risk factors. So if you smoke, your gums bleed more. If you are pregnant, because of the hormones, your gums will bleed more. If you are diabetic, because of poor wound healing, your gums will bleed more, and you need to see the hygienist regularly. Risk factors: smoking, pregnancy, diabetes, as I said, and you can prevent it by regular hygiene instead of ignoring it. These are the prices of NHS and private. So NHS prices, in order for things to be very simple, they've come up with this. So band 1 is a checkup, which is 2680. This is 2024 prices. Every year the prices keep on changing. Band 2 is a filling. For example, a silver amalgam filling is 7350. Band 3 is anything that involves a lab work, like a soft bite guard or a denture or a crown, is 319.10. So this is NHS prices. If it's an emergency, it's 2680. Now, one may ask, who are those who are entitled to free dental care? If you're on universal credit, tax credit exemption, if you've got an AC2 certificate or AC3 certificate. AC3 certificate, it means you pay something towards the total and the government pays the rest for you. If you're under 18, if you're pregnant, if you're on income support, if you're on income-related employment support allowance, if you're on income-based job seekers allowance, and if you're on pension credit. There are 2 types of pension. So please check you're on the right pension. It is pension credit, or else you will be asked to pay a penalty if you're not entitled to it. For private treatment, it depends on the practice. The practice sets their own fees. So burnout. So what is burnout? There's a difference between negative work-life balance and positive work-life balance. Do you know the difference between positive work-life balance and negative work-life balance? If there's a negative work-life balance, you end up with burnout. Now, you will never see a matchstick the same way. This is an analogy. Which matchstick are you? Are you at the beginning of your burnout, in the middle, or have you worked yourself to ashes? Work-life balance. A lot of staff do not have that sort of work-life balance. They are working, and even on holidays, they are still working. And they need to have that sort of fine balance between their work and their home life. So what does work-life balance mean to you? You're the only one who can answer this question. And the only way to analyze it is to take a big piece of paper, draw a circle, divide it into segments. Every segment should represent an aspect of your life. For example, your working life environment, your home, your life, your finance, your romance, anything that means a lot to you, and give it a score of 0 to 10. On the outer is a 10, towards the center is a 0. So give it a score out of 10, and after that, join the dots. Does it look balanced to you? If it doesn't look balanced, you are the one to do something about it. The next is stress, immunity, burnout, and racism. Some people, when they are stressed or they feel run down, they end up with ulcers in their mouth. And this ulcers clear up within 2 weeks. If you have an ulcer in your mouth which has not cleared up in 2 weeks and you smoke or drink, please seek specialist advice. If you grind your teeth at night, the medical term for grinding your teeth at night is bruxism. And at times, having a negative work-life balance or being burnt out can make you grind your teeth. Therefore, you need to find out the cause of what is stressing you up and try and do something about it. But as a dentist, we can help you. We can provide you with a self-bite guard, which you can wear at night to prevent grinding. You can do some gentle jaw exercises. For example, curling your tongue to the roof of your mouth to prevent grinding. Tooth erosion, acid, bulimia, hard toothbrush. So if you brush really hard, it sort of leaves marks on your teeth. It leads to gum recession. It makes your teeth very, very sensitive. And that's why it's important, if you're having anything acidic like pure orange juice or lemon juice, use a straw so it goes to the back of your tooth. Some people suffer from acid reflux and it can affect their teeth. It makes their teeth sensitive. You can use Sensodyne toothpaste, which you can buy for the chemist, or you can buy sodium fluoride mouthwash, which is called Fluorogard by Colgate. Also, you can go to the dentist for a prescription for sodium fluoride toothpaste, 5,000 parts per million, which you can rub over the surface. You can have fillings, you can have crowns, but every person is different. Anything that I share here, there's a disclaimer. You need to see specialist advice. You need someone to examine you. This is just knowledge that I'm sharing to help you. Halitosis, bad breath. What causes bad breath? Poor oral hygiene, having tooth decay that you haven't restored, eating too fast, and also certain food. When, for example, I may eat garlic and I may not have bad breath. Someone may eat the same thing and end up with bad breath. You need to write a list of the medication or things that you are taking that gives you bad breath and avoid them. Try and visit the hygienist. Try and have hygiene treatment. Try and eat slowly. Brush your tongue, floss, and you can use a mouthwash called 𝗤𝗏𝗏. You can buy it from the chemist and see the hygienist or dentist to find out the cause. Orthodontics, tooth crowding, or crooked teeth. The lady has got a gap between her teeth. She's smiling, she's happy. It's called the diastema. In some part of the world, it's beauty. If you've got a gap between, it's beauty. Some people want to close it. If you want to close it, you can go to the orthodontist. If your teeth are crooked, you can see the orthodontist and they can straighten it for you. But it's quite costly. Importance of dental prevention, because dental prevention is something that we are very passionate about. You want to have healthy teeth, healthy gums, and confident smiles. So how to brush? Do you use a manual or electric? If you are using a manual toothbrush, there is a technique to brushing. You need to hold the bristles at an angle of 45 degrees between the gum and the tooth and use the rule technique, moving the gum onto the tooth instead of horizontal action. If you use horizontal action, the gum recede and they become very sensitive. If you think you are heavy-handed, then please use electric toothbrush, especially the ones that flash. It's got light on it. Dental tips and importance of dental prevention. So these are some tips I would like to share with you. Number one, brush twice a day with preferably a fluoride toothpaste. Spit after brushing. Limit sweet to meal times. I never tell people not to eat sweets. It's not realistic. You can have them, but it should be after food, because after eating you salivate a lot and it's able to wash away the acid. So it's better to have it after meals instead of constant snacking. When you snack all the time, it means your mouth is being bathed in acid, acid, acid. And also, if you've got a smartphone, download the NHS Food Scanner app so that your phone becomes a barcode reader. So you can scan anything, any cereal or anything that you have in your cupboard, the barcode, and it will tell you the number of cubes of sugar in it. If you remember, during the Second World War, because of rationing of sugar, there was less decay as compared to modern times. It's good to cook from scratch if you can, because when you cook from scratch, you know how much sugar you're putting into your food. Nursing carries. So if you're a nursing mother, please, 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 when the baby falls asleep, take the breast out of your mouth, after the mouth of the baby. Conclusion. So regular visit to the hygienist and dentist is very important Register the babies as soon as your child cuts their first tooth. It normally comes around a 6. Some kids are late, others are early. So do not worry. As soon as you see teeth, start cleaning it and then register with the dentist. Remember, a confident smile starts with a good oral hygiene. And always remember, prevention is better than cure. If you have any questions and answers or any questions for me, please put it in the comments and I'll respond to it. Thank you for being patient with me. Thank you for listening and see you in my next video. Thank you.